We are running a refresher for CPR, which is Cardio Pulmonary Resuscitation. So just to remind us of the importance of CPR, and I'm also going to touch on defib as well, because that's critically important. The chances of revival or chance of resuscitation for this person hinges on those two factors, CPR and defibrillation. But the key thing is that earliest possible intervention gives the person the best chance. Okay, so we come to a situation where we come across a casualty. Now, in previous training with first aid, you went through all the steps with your doctors A, B, C, D, and at some point in there, you got to a stage where you identified that the person is going to need to be resuscitated. And those two conditions that make us determine that resuscitation is necessary are, first of all, the person is not responsive, in case they're generally unconscious, and secondly, that they're not breathing effectively, they're not breathing properly. Okay, we often just say not breathing at all, but there can be laboured breathing or air escaping the body, which is not breathing. Breathing is a process of inhalation and exhalation. So if that's not occurring, we say they're not breathing or not breathing properly. Okay, so at the point where we found the person was not responsive, that was the stage where we should have called for emergency assistance. So should have rung 000, and hopefully the paramedics are on the way, and hopefully they'll get here as early as possible. Okay, but in the meantime, our job is to try and manage this person's condition. Now, basically, cardiac arrest, as distinct from heart attack, is basically when the heart stops. Okay, now the heart may stop as a result of breathing stopping first, which will then cause the heart to stop, or the heart may stop first. It doesn't really matter in which order those two things happen. What does matter is they're both going to happen, okay, very, very close, in close proximity to each other. So now this person has a major problem. This is the number one, or this is pretty much the only cause of death. There's many causes of cardiac arrest. There are some which are still unknown. But this is the only way you can die. Every ailment that you have, which is life-threatening, every incident or acute situation that becomes life-threatening, eventually leads to cardiac arrest. Okay, and I'm not going to go through them all, okay, because again, this is a revision. So this is a situation that everybody at some stage in their life, more often than not, right at the end of it, finds themselves. Okay, so what we're trying to do is we're basically trying to bring this person back. Now, we're limited by, of course, what we have at our disposal. So often, if we're in a situation where maybe it's in a social gathering, or it may be, that we're just going about our day-to-day business, we often don't have anything. All we've got is our hands. So I'm going to start with a manual CPR procedure where perhaps we don't have a defibrillator. We're not equipped with all the gear that we may be at work. Okay. So what do? So this is kind of your old school CPR, I guess, in the days before defibrillation. Alrighty, so there's a couple of guidelines when it comes to CPR. So again, you'll be familiar from the literature that was provided, basically in relation to the amount of head tilt, the age of the person, the method of compression, and those kind of things. It is relatively standardized, okay, in terms of 30 compressions, 2 breaths, and so forth, okay, which again, in years gone by, it was different, but at the moment, it's standardized. And there is a couple of variations in terms of whether we do compressions first, whether we commence with breathing first, or sometimes whether we don't do breathing at all. Okay, so I'm going to cover off on those 3 things first before we look at a slightly different approach if we do have access to defibrillation. Okay, so let's assume, first of all, the guidelines for an adult would be a full head tilt, so chin pointing to the ceiling, and that's to open up the airway, okay? And we're looking at using the method, I'll just get myself into the CPR position. We need to have the shoulders pretty much the center of our body. Okay, we're using the heel of the hand. Okay, the arms would be straight, and I would have 2 hands. Now, whether they're interlocked, whether it's placed on top, that's entirely up to you. So that's our position, but we'll go through the performance in a moment. The depth of compression is what we say, a third of the depth of the chest, okay? Well, basically, the thing to get from that is it's actually quite a significant amount of force required to get the compression through the chest and to the heart. What we're trying to do manually is we're trying to squeeze the heart to force the blood out of the heart. What's happening with this situation? The person's not breathing and their heart's not beating. So the critical thing right now is the brain is not getting a supply of oxygen, and the brain is starting a process of brain injury or eventually brain death. Okay, so the person, the longer the delay in resuscitating this person, the greater degree of brain injury this person will sustain, or it may get to the point where the person, even if able to be resuscitated, can't sustain their own life, which is often the point, say, in a medical setting, or the paramedics may just declare the person dead. So say, look, you know, the amount of attempts we've made, the amount of time that's passed, you know, it's you know, statistics tell us that it's probably futile to continue. That's not a decision that we make, though. As a first aider, our role is to do CPR or defib as well, if we've got defib, for as long as we physically can, or until the paramedics come there to take over, or unless the person is resuscitated and revived, of course. And, you know, that's obviously the best case scenario. But we can't say, look, you know, it's not even worth trying. Every attempt is better than none, okay? So let's assume in this case then, the person's not breathing, the heart's not beating, they're not getting any oxygen to the brain. So we need to find a way to give them some oxygen, which is in the air that we breathe, okay, and some way to compress the heart in order to move that blood around. Now, I mentioned 3 different methods. Now, first of all, again, on the assumption that, you know, you were out and about doing your daily thing and you weren't expecting to have to do this today, you possibly don't have, or you almost certainly wouldn't have with you, any barriers to protect you from infection. Okay, so given the last 2 or 3 years that we've just lived through, I guess it's more at the forefront of people's mind, you know, risk of infection, even though, you know, there's always been risk of infection. So sometimes that might form the basis for you to say, look, I'm not prepared to do mouth-to-mouth because, you know, the risks to me are high of catching, you know, something, and particularly nowadays, you know, we think in terms of COVID, but all the other things we used to be able to catch are still out there. So on that basis, you know, the first stage of your doctor's ABCD was danger, and primarily danger to yourself. So that would be included as danger to yourself. So on that basis, you are permitted to do, or it is quite acceptable to do, compressions only. Okay, so I went through my doctor's ABCD. Okay, I decided I'm going to start CPR. I don't have defibrillation. I don't have any barrier to protect me from infection. I just go straight into compressions. And in that case, the 30-to-2 ratio is not critical because I'm not doing the 2 breaths. So the obvious question that comes to everybody's mind is, okay, if I'm not doing the breathing, where is the oxygen going to come from? I mean, that's a fair question to ask. So in this case, what happens is when I press down on the chest, it forces some air from the lungs out because of the compression, okay? And when I take the pressure off, it draws a little bit of the air back in. Is it as good as us trying to put air in? No, it's not. Is it as good as them breathing themselves? No, it's not. But it's not zero. It's better than nothing, okay? If it's you saying, look, I'm not prepared to do it because I don't want to catch something, so I'm going to do nothing at all, the person has no chance of survival, 0. Nothing at all will bring this person back, okay? So compressions only, okay. I want my arms to be vertical over the top, okay, arms straight, so I'm not doing it as like a push-up or a tricep extension. I'm just letting gravity do the work, okay, and dropping my body weight in. Probably the biggest mistake most people make is they don't press hard enough, okay, because they're worried about breaking ribs, you know, and they think broken ribs will lead to a punctured lung. Those things are not relevant in this situation, okay. Reality is, particularly for an adult, there's a really good chance you will break some ribs, and usually the break is at the sternum level, is where you're applying the pressure, okay, because the resistance is coming from the rib cage, and we're trying to get through the rib cage to the heart. So that's quite an acceptable consequence of the amount of force that we need to use. And in fact, you know, if that were to happen, your compressions would get deeper anyway because the resistance would get less. So it's not the worst thing. Punctured lungs is not going to happen from CPR, okay? Just the mechanism of broken ribs to cause punctured lungs is not what's happening here, okay? It's not an external force coming from the side forcing the rib to break inwards, okay? That's not what we're doing here. We're pressing downwards on the sternum. All right, so don't worry about those two things which may act as a mental block to prevent you from pressing hard. Okay, it's got to be nice and strong. All right, so that's compressions only. Okay, the other option is to whether I start with the breathing or whether I start with the compressions. Okay, and the way I would approach it is this: if the person collapsed in front of you there and there, you're standing around talking and the person collapsed, they've already got oxygen in their blood, okay, because they were only breathing a few seconds ago. I would start with compressions first, okay? Still do your 30 compressions and then go to your 2 breaths. Again, when it comes to the barriers and risk of infection, that's a decision that you have to make. If it was a family member or a close friend or something like that, you probably wouldn't worry as much as if it was a complete stranger. Although having said that, the risks are exactly the same, all right? But, given that in a family type environment or someone that's close to you or you've got a bit of an emotional involvement as well. Sometimes when you're emotionally involved, you make decisions based on that emotion, okay? If it's purely from the science point of view, risk of infection is the same, whether they're young or old, whether they're beautiful or ugly, whether they're a family member or a complete stranger, the risks are the same. However, your preparedness to do it is probably different based on your relationship to the person. If it was a partner or a family member or one of your children, I think you wouldn't hesitate for a minute. But that's a decision that you need to make. All right, but the mechanism's the same. 30 compressions, 2 breaths. Now, we demonstrated the compressions. Now, with the breaths, again, it's head tilt, pistol grip, okay, on the chin, okay, seal the nostrils, okay. When you breathe and look towards the chest. Breathe and look towards the chest. And what we're trying to get is some inflation. Now, it's not going to rise, noticeably, okay. And then we come back and we go straight into compressions. And we continue that, okay? We may check after a couple of cycles to see whether their condition has changed. And if it hasn't, if they've not been revived, we just keep going. Again, we're talking about a situation where we don't have a defibrillator, okay? The other option was whether we start with the breathing first. Okay, so I would say if I came into a situation, the person was already collapsed, I don't know when they collapsed or how long they've stopped breathing for. I don't know when they took their last breath. Assuming I make a decision that I'm prepared to do the breathing, okay, or maybe I've got some barriers with me, then I'll start with breathing first. And then once I've done the breathing, 30 compressions, and then it's exactly the same. Okay, so I talk about barriers then. All right, so a couple of options you've got. There's plastic face shields, okay, not just a sheet of plastic. These are a little bit different because they've got a gauze section in here. That gauze section goes over the mouth, okay, and that acts as a barrier that we breathe through the gauze section in the shield. They come in a roll like Glad Wrap. You pull one out, you rip it off, and it's disposable. You only use it once, okay? If you notice paramedics don't do mouth-to-mouth, okay? They use a bottle, okay, and over the face, okay, and it goes over the nose and the mouth, okay, so it's not critical to seal the nose, okay, and then you're administering air through the bottle, okay, and again, preventing immediate contact. You need to change the mouthpiece if you're using it on a second person, okay? So there are a couple of methods that act as barriers as well, alrighty? Okay, so that's without defib, okay? If we look at our defib then, this is a bit of a game changer because really the purpose of CPR is not really, or the chances of bringing the person back with CPR alone are pretty remote, okay? The chances of resuscitating the person with defib and CPR are far greater. Not 100%, a long way short of 100%, but also not zero, okay? Again, the key is the earlier that you can apply the defib, the earlier you can commence the CPR, the greater the chance the person has got to be resuscitated. Not guaranteed, but a much better chance. Now, first of all, with the defibs, okay, now we're assuming this is an adult, so we've got the pads, which are adult pads, and there's diagrams on them that shows you where to put them, basically over the right chest and on the left rib cage. If we swing around here, it's just there. I'll just place them for the time being, okay? It has to be on a bare chest. It has to be on a dry chest. So if the person has been pulled out of a pool or something, you've got to dry the chest, okay? If they're super hairy, okay, now I know it sounds odd, okay, you need to get direct contact on the skin. Most first aid kits should have a razor blade in them, okay. You would shave only the section that you're going to apply the pad, usually chest, not often that you need to shave the side, all right. But anyway, that would be for a small percentage of the population. Okay, once you put the defib on, you turn it on and it'll communicate with you. I don't know how well you can hear that.
Analyzing heart rhythm.
It's analysing the person's heart rhythm.
Do not touch the patient.
It's important that we're not in contact with the person, otherwise it's going to read our heart rhythm. We don't want that. Yeah?
Shock advised.
It's advising shock because it didn't find any activity. Right? And it's a manual charge.
Stay clear of the patient.
It gives you the warning to stay clear, not because you're going to explode.
Shock now. Press the orange button now.
So there's a button on the defib. Okay, you press that button.
Shock delivered.
It'll read again.
Start CPR.
Okay, it didn't find a signal, so it's giving us the instruction to start CPR. We leave the defib on, okay? So some models have the beep like this one, which gives you the guide for the rate of compression, okay? Some don't, so you have to keep count, okay? If you lose count going to 30, okay, then you count to 10 3 times, all right? Now I'm explaining while I'm doing it, so I've lost count, but that doesn't matter, all right? So the mechanism is the same, 30 breaths, 30 compressions, 2 breaths and so on. The same as if you didn't have the defib. The only thing is after a couple of cycles, this will kick in again and it'll repeat. Okay, stay clear, checking the heart signal and so forth. If it was to find a signal, it'll say commence CPR if required. Okay, that means it may have found some activity, but you're checking to see whether breathing has returned. Because if breathing hasn't returned, it's redundant. The heart will stop again. If the person does recover, breathing starts, okay, which means the heart will have restarted. I leave the defib on, I put them in the recovery position, okay, and then I start looking at bleeding and so forth. I don't cancel the paramedics. This person still has to go to the hospital, okay? All righty, so we let that do its thing, okay, and it'll kick in again, okay. So that's with the defib. Now, a couple of things to consider. If I'm in a situation where I'm on my own, okay, so let's say I'm in the workplace, I know there's a defib, you know, at the reception or the front when I come in, okay, I need to go and get the defib first, okay, get the defib, apply the defib, okay, don't commence CPR and then after a couple of minutes say, okay, I think I'll go and get the defib. The most critical component, if a defib is available, the defib is the most critical component, okay, we need to get that on as soon as possible, all right. If there's 2 people, okay, if you've got an assistant or there's multiple people, okay, one person commences CPR immediately, send the other person to go get the defib immediately. As soon as they come back, you put it on straight away, you turn it on straight away. When the machine tells you to stand clear, then you stop CPR. Let the machine do its thing, and then you may need to continue CPR. All right, so that's important. All right, so the earlier you can get the defib there, the better. If you're on your own, go and get the defib first. If you don't have a defib, then we're just doing CPR, which again is better than nothing. CPR is about protecting the brain from injury or slowing down the rate of brain injury due to lack of oxygen supply. Defibrillation, on the other hand, is the electrical charge to try and restart the heart's electrical impulse, electrical rhythm, which is a communication from the brain. When the heart stops, that communication has been lost. So we're trying to re-establish that electrical impulse. And that can only be done by defibrillation. Don't stick the person's finger in a PowerPoint or anything like that. Okay, that's not going to work. It'll probably have an adverse effect. You know, not that it could get much worse, but it would be worse and you'd probably end up in jail. So defibrillation is the way to try and do that. Now, let's assume this was a young child, not a baby, but a young child. Let's use the same mannequin for these purposes. The head tilt would be similar, maybe a little bit less. In the literature, it says, you know, half head tilt or partial head tilt. The only difference would be perhaps in the method that you use to compress. Sometimes it recommends one arm. Now, for balance, okay, depending on you as well, whether you can get, the key thing is whether you're getting a third depth of compression, okay? If you can get a third depth of compression with one arm, fantastic. I find it helps if you balance yourself by holding the other wrist. Okay, and it just gives you, it's a bit easier than trying to do when you do that, it you sort of feel like you start to press this way, and I want to keep the arm straight. Okay, and this enables me to still have my body weight over the top. Alrighty. Otherwise, the breathing is the same. The depth of compression is the same. Third depth of the chest, 30 breaths, 30 compressions, 2 breaths. Okay, everything else is the same. Slightly less head tilt, and the method is the key difference. Okay. All right, but again, if you're a bit smaller, a bit petite, you might still go with 2 arms. If you're, and again, also it depends on the size of the body that you're dealing with, because children can range in size. Once they get to that kind of puberty and onwards, we treat them the same as an adult. Okay, but again, that's something that you judge. If you find you're not getting enough compression with 1 arm, you just go with either assist, hold the wrist, or you go 2 arms. Okay, all right. A little different if it's an infant. Okay. Literature says no head tilt or head in a neutral position, which just means like if the infant's laying on the ground, it's the position the head is in now. Okay. If I go back with the head or forward with the chin, I actually close the airway, and that's not what I want. There's a big difference, however, in obviously the thickness of development of bones. And also the size. So I go with 2 fingers, okay, for the compressions, and the breathing, because my mouth is, it's very difficult to get a big mouth on a little mouth. So we cover nose and mouth, and it's more of a puff rather than a full strength blow, because the lungs are only tiny. Okay, so it's a puff, mouth covering nose and mouth. Make sure it's sealed. Okay, and then 2 finger compression. The rate is the same, 30 compressions, 2 breaths. The depth of compression is the same, 1/3 of the depth of the chest. All of that is standardized. The difference is the degree of head tilt, okay, which is none for an infant, okay, and the method, which is using 2 fingers. Now, if you've got super long fingernails, okay, you may choose to use your thumbs, and that's fine as well. Again, the key thing is as long as you're getting 1/3 of the depth of compression. Now, when it comes to defibrillating, okay, there is, there's mixed views on defibrillating with infants. But there are pediatric pads, which are smaller defibrillator pads for infant, and you may not be able to see from that distance, but you may be able to see that where it tells you to put them is basically 1 on the front and 1 on the back, okay? And then same deal, you turn it on and we go through the same. Again, it's exactly the same process for the adult. The difference is where we place the pads. So I'm going to apply the shock.
Stay clear.
This is only a training model, obviously.
Deliver shock now.
So I'll press the button again. Okay, so if needed means check that they haven't started breathing again. Okay, I find nothing, so I go my 2 breaths, and the CPR directly over the pad, doesn't matter, okay, because the pad's on the point where I need to apply the compressions. It doesn't matter, you just push through it. All right, it's not going to be a problem. You're not going to get charged or anything like that. Okay, so that's another difference with the infant CPR. Okay, there is an option to have the infant cradled in your arm for breathing compression. Okay, a little bit difficult with defibrillation, obviously. It's better to have them on the floor. All righty. Okay, so how long do we go? We go until we can't continue. We go until the paramedics come there to take over. We go until the person's made a recovery, or maybe in the rare situation where it becomes unsafe for us to continue. All right. Although that's unlikely, but it is part of the protocol as well. It's part of the dangers. All right. So that's the mechanism for CPR. Like I said, with defib, the chances of resuscitation are far greater. Okay. The earlier the better. Okay. That's important. Use your barriers to protect you from infection. Always put rubber gloves on for every first aid situation. Particularly in the workplace. It would be part of your standard practice, but also get in the habit of it, because risk of infection for all sorts of things in first aid, not just bleeding, with vomit and bodily fluids, but even with touch. And we know, we're probably more aware today than ever of the possibility of airborne pathogens and so on. So if you want to wear your masks and everything, I mean, they're all things that are protecting you from infection. Masks, goggles, and those types of things. Okay, so if you've got them, well, we encourage them. If you haven't got them in your first aid kit, put them in your first aid kit, because it protects you as well as the other person. Alrighty, so that's where me